Hi, my name's Sarah Johnson, and I'm the Principal Strategic Advisor for the Northern Integrated Family Violence Services Partnership here in the Northern Metropolitan region of Melbourne. This interview is part of a service system overview series to enhance understandings of the family violence service system here in the Northern Metro region. I'd like to begin by acknowledging the traditional owners of the land on which we're recording today. For me, that's the Wurundjeri people of the Kulin Nation. And I would like to pay my respects to elders past, present, and emerging, as well as any Aboriginal people who may be watching today. Sovereignty of this land was never ceded. It's my pleasure to introduce Sarah Rogers, who's the Program Manager for Triage and Response for Hugh Moreland for Berry Street's Northern Specialist Family Violence Service. Welcome, Sarah.
Thanks, Sarah.
Sarah, I wondered if you could tell me about what Berry Street does and also who can access the service.
Yeah. So the Berry Street Northern Specialist Family Violence Service provides free specialist family violence services to women, children, and members of the LGBTIQ plus community experiencing family violence in the Northeast and in Hugh Moreland LGAs. So Berry Street offers a number of specialist family violence responses, and this could include intake and assessment, case management, counselling, court support. We run the personal safety initiative, and we have outposts at various locations. I manage the Hugh Moreland Triage and Response team, which is the intake point to access Berry Street's family violence services in Hugh Moreland. So the Triage and Response team receives all the police referrals from family violence incidences in Hugh Moreland. So these are called L17s. We receive referrals from other specialist family violence services, and we also receive the self-referrals for the Hugh Moreland region.
Thanks, Sarah. And we know that in the northeast Melbourne area, the Orange Door performs a similar function. You mentioned the police referrals, and I'm wondering if you could tell me more about what happens to those police referrals that come to Berry Street there in Hugh Moreland.
So the police referrals, the L17s, we triage in two ways. So where children are listed, we triage L17 through what's known as MAT, which is a multi-agency triage. And this incorporates child protection, VACA, DPV, which is the men's service, and Child First. So this was a collaboration between the agencies to provide a differential response so that not all police reports were just immediately going to child protection. So what happens now is that the multi-agency triage provides a single door approach where a collaborative risk assessment is undertaken by multi-agency representatives. And this then triages that referral to an appropriate service. So that could be that a police report is triaged for a response from Berry Street for a family violence response. The perpetrator of violence is triaged for a men's response, and also the L17 is sent to a Child First for a intake into family services. So it's providing lots of options and integration for a family response around family violence incidents. So L17s where children are not listed are triaged internally by Berry Street. So we decide on an appropriate response. So it could be a high risk response, so we're really worried about that family, and we're going to make multiple assertive attempts to contact that family, or it could be maybe a lower level family violence incident where we might just make one phone attempt to contact that family.
Thanks for clarifying that process for us, Sarah. I'm wondering what kind of response a victim survivor might expect to get from Berry Street.
So we provide a critical voluntary pathway for victim survivors to access different family violence services and other supports. So at intake, we provide practical support and information about the experience of family violence. We complete a risk assessment and safety planning. We look at safe accommodation options. We look at referrals for legal services or advocacy and access to financial entitlements, and also looking at referrals to other appropriate services that could include counselling, it could include external services or internal Berry Street services, like could be case management.
Thanks. And could you tell us a little bit about how workers might refer victim survivors to the service?
Berry Street has specific formal arrangements with Victoria Police, Safe Steps, and other specialist family violence services. But we don't accept referrals from other services to provide a victim survivor with a family violence response. There's a number of reasons that we don't accept referrals from other agencies. Um, this includes safety concerns for receiving a referral. It could be victim survivors' readiness to engage in a service like ours, making sure that a victim survivor isn't coerced or pressured in any way by a service to access a family violence service, and making sure that there is consent for a victim survivor to be referred to a service like ours. We are a completely voluntary service, and we rely on victim survivors being really ready to contact and access our service and do that with absolute free will. So we really advocate that services provide a victim survivor with our contact details so they can choose when and if they contact Berry Street Family Violence Service.
Thanks for that, Sarah. I'm wondering if you could tell me now a little bit about what workers should be aware of when they're supporting a victim survivor of family violence.
I think firstly, if a worker is working with somebody who's disclosed family violence, that it takes a huge amount of courage for somebody to disclose family violence, and also that this might be their first ever time that they've disclosed their experience to anybody. So I think it's imperative that a safe space is created and that the worker really listens and affirms the victim survivor's experience of family violence. I think when working with a victim survivor, it's really important to know that they are the absolute experts of their experience, that they are the most knowledgeable source of information about their own safety based on their experience of the perpetrator's behaviours. And they're also highly practiced in safety planning and responding to and resisting the perpetration of violence. As I've mentioned before, I also think choice is critical. So, providing information and referral options, validating the victim survivor's choice to access a family violence service or not access a family violence service. I think the victim survivor needs to be able to choose what happens next for them. And if in doubt, and if you're worried as a worker, consult with a specialist family violence service.
Thanks, that's really comprehensive. Sarah, we know that demand on the service system is huge. We've talked about the police referrals, self-referrals. We know that there are thousands of victim survivors entering the service system here in the Northern Metro region every year. And we know that not everyone that is referred to Berry Street or seeks support from Berry Street will necessarily receive, for example, a case management service. I'm wondering what practitioners can do if they're unable, if Berry Street's unable to provide a service.
So I think first of all, we provide a service to everybody that calls our service. So if a victim survivor is self-referring, they will receive a callback and quite quickly because we don't have a wait list, and they will receive a response. I think it's really important to note that the majority of the work we do is episodic. So this means that a victim survivor can access our service and through a phone call, and that could be the only support they receive because that could be what they wanted, or it could be that we do a piece of work with them that lasts 4 weeks because we've had a phone call, we've done an FSP, we're looking at Centrelink payments, and then that support period closes. But I think it's really important to note that there is no limit to how many times a victim survivor can access our support and disengage and access again episodically. So we could be supporting someone for 2 years, but it's at the victim survivor's pace. So they could call once every 3 months to engage in a service and have a response, and disengage if they choose to. I think that sometimes case management is a very specific service option for victim survivors experiencing family violence with really complex needs and long-term case management goals. We've found that we can provide really effective family violence responses to people episodically as they need, to help risk assess and safety plan for those victim survivors.
Thanks, Sarah. It's great to have that extra information. Sarah, I'm wondering what advice you might give a worker who's supporting a victim survivor who may not want support from a specialist service like Berry Street, or who may only be accessing the episodic support.
So I just think consult. I think wherever possible, we are so happy and willing to provide secondary consults. We think it's absolutely imperative that the service sector feels that they can access our service to assist them in providing really good family violence responses to their clients. And we know that it's best practice for the key worker who's really engaged with a person to lead a response for a person. So you might have a client that isn't engaged in our service but experiencing family violence. Consult with us, talk to us about it. We can do it de-identified to provide the best possible service response for that client.
Thanks so much, Sarah. It's been great having you along today, and I really appreciate you spending time talking about Berry Street's Northern Specialist Family Violence Service.